stimulation and care, especially in their first 3 years, a child born without disabilities can fail to reach optimal development, acquiring disabilities similar to those of their parents. These environmentally acquired disabilities create long-term negative consequences for the child and the community. Our goal is to prevent these at-risk children from perpetuating a generational cycle of environmentally acquired disability, abuse, neglect, and poverty. We address challenges faced by both parents and children so that children can succeed in school and fulfill the developmental potential with which they were born. In the 1950s, Elizabeth Liesel Wechter founded the Pearl Buck School. This school, founded to serve children and young adults with developmental disabilities. Liesel was shocked that there was no educational services for this population. So with the help of the community, she began a school to provide educational services for the developmental disabilities population. As you can see in the pictures, young adults learn classroom skills and home living skills in small apartment-like settings. Liesel taught individuals how to become independent, lifelong learners of their environment. As individuals aged, Liesel realized that they were in need of employment. No longer in need of schooling in the traditional sense, individuals were in need of vocational, employable skills so they could earn a living. Liesel went to several area businesses and asked if they had any assembly-type jobs or collating that needed to be done, and Pearl Buck Productions was born. As the needs of the clients and the community changed, so did Pearl Buck Center. So in the 1970s, when children moved into public education, and when the University of Oregon and the United Way of Lane County did a community-wide needs assessment and found out that the many individuals with cognitive disabilities were parenting, the organizations approached Liesel and asked if she would start a school to serve the children of parents with cognitive difficulties. This is the school that is in operation today. In the 1980s, Pearl Buck Center began its community-based employment initiative, where clients are employed in the community with and without job coaches, earning incomes comparable to their peers. In the 1990s, Pearl Buck Center opened the Life Enhancing Activities Program, also known as LEAP, which is an alternative to employment program. This program serves the aging population and those with more significant disabilities, or those who choose not to work. The program offers recreational and social activities to do during the week. So under one roof, we offer a lifespan of services to address our mission. Our mission is to enrich the lives of those affected by disabilities through vocational, recreational, and educational programs. For today's presentation, I want to call your attention to our preschool. We are a unique preschool in that we are the only preschool that we know of in the United States that offers this type of service, that is, tuition-free with transportation, meals, and program-wise positive behavior supports. We offer a half-day program for 2 to 5-year-olds. We also have a full-day Head Start supported program in our building. Most of the children we serve were born without disabilities. All of them have at least one parent with cognitive difficulty. Parents with intellectual and other cognitive limitations face unique challenges in raising and caring for their children. Children of parents with intellectual disabilities are at risk for developmental delays and behavior disorders. These children also face environmental risk conditions that have a multiplier effect. These include family poverty, unsafe or unsuitable housing in low-income neighborhoods, chronically poor health, social isolation, and unequal access to health, education, and social services. Most of the parents we serve fall in the 70 to 80 IQ range and receive special education. A person with an IQ of 69 or below qualifies for developmental disability services. However, even for eligible clients, parenting assistance for children's literacy and social-emotional development is unavailable. As mentioned, a local study first identified these underserved families in our community when United Way of Lane County and the University of Oregon conducted a community needs assessment in 1976. Most communities do not recognize or acknowledge that people with cognitive limitations are parenting. Despite being loving parents, adults with cognitive disabilities are especially challenged to nurture their child's development without support. Without adequate stimulation and care in their first 3 years, a child born with disabilities can acquire disabilities similar to those of their parents. This environmentally acquired disability can have lifelong negative consequences for the child and the community. Our guiding philosophy is that all children need a safe and nurturing and enriched learning environment to reach their fullest potential to enter school ready to learn, that their parents need respect and support in their parenting efforts. We realize this philosophy through our program goals. Children will learn basic self-help skills. Children will learn basic concepts they need for school readiness. Children will learn to express their feelings with words and develop a sense of caring for others. Parents will be successful in their efforts to provide a safe and nurturing home. To address these goals, we employ a wraparound service delivery model where the teachers, staff, behavior support coordinator, and parent navigator wrap around families' needs. As an example, here is a story of Daniel. Daniel was enrolled in our pre-K class and was presenting with some challenging behaviors at school. Specifically, Daniel brought a lighter to school on 2 occasions. On one occasion, Daniel and his peers built a play campfire on the playground. When it was time to light the fire, Daniel brought out a real lighter to light the wood chips. A peer, scared of what Daniel might do with the lighter and knowing our rules of we are safe, found a teacher. The lighter was confiscated and the parents were called so that services could be discussed. With a little probing, it turned out that lack of supervision of the 5-year-old at home was a bigger issue. The 5-year-old was often allowed to leave the home for many hours at a time without supervision and was often getting into trouble, like picking up neighbors' lighters and picking up cigarettes. The behavior support coordinator made an appointment with the family and created some materials to help the family come up with some general guidelines and better understand developmentally appropriate expectations and levels of supervision. A check system was implemented where the children checked in with the parents frequently. In the meantime, Child Protective Services also got involved due to an environmental cleanliness issue. The family was referred to our Intensive In-Home Safety and Reunification Services, an intensive 6+ week program for family services. Our ISRS Parent Navigator worked with the family to organize and clean up the home, as well as work on supervision issues. The worker also referred the family for a pilot project with the Oregon Social Learning Center at the University of Oregon called Filming Interactions to Nurture Development, or FIND project. FIND is a 10-week filming and coaching strengths-based intervention designed to support families further develop their skills in 5 critical component areas, such as sharing their child's focus of attention and naming. The FIND program begins with the FIND coach recording a video of caregiver and child in their home or other natural setting. The film is carefully edited to show brief clips in which the caregiver is engaged in developmentally supportive interactions with the child. At the subsequent coaching session, the FIND coach reviews the edited clips in detail with the caregiver. The sequence of alternating filming sessions and coaching sessions is repeated 5 times for a total of 10 sessions. FIND utilizes the concept of serve and return that was developed at the Harvard Center on the Developing Child as the framework within which developmentally supportive interactions are identified. A serve occurs when a child initiates an interaction using words or gestures or by focusing their attention on something or someone. The serve is returned when the caregiver notices and responds. Within the context of FIND, 5 specific elements of serve and return are emphasized, with one element introduced in each coaching session. Daniel's family has excelled in this program. Not only has Daniel's father demonstrated all components in the filming sessions, but he has also stated that this is the only time in my parenting that anyone has told me that I am doing something right. Daniel's father has now attended all family nights and participates with great enthusiasm. Daniel's father has attended voluntary focus groups and participated with great ideas on how to improve school activities. His relationships with his children has been transformed. The home environment has improved. The family bought new carpet, have put in a few new furnishings, and overall have a new pride about their home. The Child Protective Services case is closing. All children are remaining in the home. At Pearl Buck Preschool, we practice program-wide positive behavior support. We have agreed to the following. We are safe, we are respectful, we work together, and we are fun. The children earn puffballs or pearls for following the rules associated with these agreements. For example, for using walking feet and being safe in the hallway, they earn a pearl in a small fishbowl. When the classroom fishbowl is full, the class works together to dump the fishbowl into the school-wide fish tank. And when the fish tank is full, the school earns a family night full of fun. The following slide depicts our theory of change. Population served is children of parents with cognitive differences and parents with cognitive differences. Programs and services is quality preschool experiences, behavior support, parent mentoring and support, and basic needs support. Outcomes include kindergarten readiness, increased parental capacity, stabilization of home environment, and exposure at home to literacy and social-emotional development tools. We address the following 6 protective factors by the activities listed. Outreach to pre-enrollment families and home visiting addresses nurturing attachment. Knowledge of parenting and child development through home visiting, family nights, outreach to pre-enrollment families. We address parental resilience through home visiting, family nights, and outreach to pre-enrollment families. Family nights and community visits addresses social connections. We provide concrete support for parents through our home visiting program, family nights, and outreach to pre-enrollment families. Our social and emotional competence for children through our kindergarten readiness activities. We use an emergent curriculum in the preschool addressing kindergarten readiness skills such as self-regulation and pre-literacy skills. As I mentioned, we practice program-wide PBIS, and we have a comprehensive wraparound service delivery model. We collect data and make database decisions about our model. This slide shows our outcome measures. Maximize the percentage of preschool students who have at least 80% of identified kindergarten readiness skills. Maximize the percentage of children who are developing within normal limits. Maximize the percentage of children who receive specialized intervention services for identified delays. Maximize the percentage of children whose immunizations are up to date. Maximize the percentage of parents who maintain safe and stable housing for the family. Maximize the number of parent satisfaction surveys where parents agree or strongly agree that the services are satisfactory. Maximize the percentage of parents who agree or strongly agree that the program gives them the support they need to successfully parent. Maximize the percentage of parents who report reading to their children 3 times a week. Maximize the percentage of parents who attend preschool activities 3 times in the school year, including class visits. Maximize the total number of volunteer hours benefiting the preschool program for the year. Minimize the number of no-shows reported by the ride source, which is our bus system. Maximize the percentage of enrolled students who attend school as scheduled. Some of our highlighted findings include graduates from our program are entering regular education classes, they're attending school, making friends comparable to their peers, they have good social skills, they're displaying school readiness skills, good language and motor skills, and their parents are returning paperwork and attending conferences. Students attending our school are identified and are receiving intervention services when needed. Their immunizations are up to date, and they have medical and dental homes. Parents are satisfied with the program. They're reporting that the program helps them to become a better parent, and their children are learning new skills. Parents are reading to their children at least 3 times per week. They are involved in family nights, and their attendance is consistent. Some of the practices we are using are evidence-based, and some are considered promising practices. We are proud of our outcomes and continue to collect the evidence needed to make the decisions necessary to improve our practices. Thank you for your time. I can take questions.
Thank you so much for your time, Renee. I'm just going to take back over control of the screen.
Great, Olivia. Thank you.
What I didn't mention to the audience is that we're actually streaming you from Oregon. So what is it, about 5 p.m., 5:30 there now?
It's the end of the day here.
Yeah. Well, thank you very much for making the time at the end of your day and the end of your Thursday, I think, to speak to us. A couple of questions have come through, a few good ones indeed, just asking first of all around attendance and family engagement. What do you think has been some of the successful strategies that have been employed in the preschool to promote attendance and family engagement?
Well, for attendance for school, it's our busing system. We have a contract with our local bus system called Ride Source here in the area. So it's our local transit system. And without that, we believe our attendance would be very low. Right now, our attendance is at about 98% for our 3 classrooms for the year, and that's really good. So I think that's it, has a big piece of it. The second piece is the family night, and that, I believe, has increased over the years based on our incentive system. So we are able to, through the grants that we have, provide some gas vouchers and other incentives, cards for local grocery stores and things of that nature for families that attend family nights, vouchers for diapers, vouchers for groceries, things like that. And I think that has had a big impact on attendance.
And another question that's coming through is how are families identified for children to attend the Pearl Buck Centre? That prompts me to ask, what's the journey, I guess, of someone who might not have been involved with services before, who has a child? What's their journey? How do they get to the Pearl Buck Centre?
So many of our families come through the public health system. So a parent is identified either at pregnancy or at child's birth through the public health system or through our Child Protective Services system, and they are identified in need of additional parenting support. And so in order to keep that family intact, they often are given services through our Pearl Buck system. Unfortunately, funding is such that we have very limited supports that we're able to give through our pre-enrollment piece of services. We're able to visit about once a month, and oftentimes that's not enough for the families. So public health is our #1 way that we're getting referrals right now. So a public health nurse will give us a call and say, I have a baby, mom has a cognitive difficulty, I want that baby on your wait list. And so our wait list, or pre-enrollment list as it's called prior to the child turning 2, is rather lengthy.
Yeah, I was just going to ask. And is it a matter that everyone who goes on the wait list is able to access the service?
No, we only have class size of 10. So we have a 2-year-old class that are 10 kids, and then a 3-year-old class 10, and a 4-year-old class that's 10. So unfortunately, it's a first come, first serve. So whoever's on the pre-enrollment list is first, and then we carry a wait list.
Another question around what happens when the child goes to school. Does the parenting support continue? Is there a time limit for them to be involved with Pearl Buck?
We don't have ongoing supports for the family, although nothing formalized, although many families stay in touch informally with Pearl Buck. They call us, ask us for agency referrals and things like that. What we feel we're doing is getting the parents as ready as the children for the public school system. So many of our family nights or home visiting has to do with how to navigate that public school system and fill out paperwork. So a lot of what we do here is start very hands-on, very supportive, and then fade out those supports. So once the kids turn 5 and are ready to graduate into the public school system, we're graduating those parents as well. And so the supports aren't there, unfortunately, and they aren't in the public school system.
Well, that ties in nicely to this question, actually, which is, what do you think the most important elements are in supporting parents to learn effective parenting strategies?
Well, that's a very good question. You know, the biggest thing that comes up for us are 2 areas, supervision and routines. We often, when we're in the home, lack of supervision of the children and lack of routine in the home around sleeping and eating tend to be 2 areas that we provide a lot of support. And we think it's not necessarily it's just a lack of knowledge and a lack of a certain way of living. And we're not there to impose that on the family, but as a suggestion for the little ones that are going to follow routines at school. So for example, the kids are learning to brush their teeth at school after a meal, and then they're bringing that routine home, and the parents are thanking us for, you know, thank you for that routine, because now the child's reminding me to brush my teeth after a meal. There's things like that that are happening. So routines and supervision are 2 areas where, just in the general, if I were to pick 2 in parenting skills, I would say those were 2 big ideas that we provide a lot of support with. I don't know if that answered the question, but that's kind of how I took that.
Yeah, they're the strategies that are employed that get your outcomes.
For us, the home visiting and wraparound services are really what we're using now to support the families. So in the classroom, you know, the hands-on learning and opportunities and positive reinforcement, the positive behavior support, as well as at home, the home visiting model, not just sitting and discussing and having a chat, but really doing some skills-based role modeling, having it be at the family night and bringing that home as well. Model demonstration is really helpful for our families.
Mm-hmm.
We introduce it at family night, and then in the home visiting model, we're practicing it and giving a lot of support and feedback and
mm-hmm.
follow-up. Without that piece, I think it would just not generalize.
Yeah, yeah. And one of our attendees from South Australia, Kerry, is just concurring that home visiting has shown very good results in Australia as well.
Yes.
Another question, what sort of support is there? Is there anything from Pearl Buck or just more broadly for under 2-year-olds?
There is, in the community, there are several home visiting programs that are available, not specific for families with cognitive difficulties. We have our own HealthyStart program, a nurse family partnerships program that are under 2-year-olds. For our families, we have the pre-enrollment, so we have a parent navigator that goes out to the home about once a month that does developmental screenings, does the ages and stages questionnaire, and does some modeling and does the FIND program as well that I mentioned in the presentation. So we do have some limited funds to provide some supports in the home for our pre-enrollment children to essentially get them ready for the 2-year-old preschool classroom.
Mm. And back to the actual preschool program, do the parents who are engaged, are they involved in literacy programs at all, and who delivers those?
It's part of our family night series. We do some, I don't want to call it instruction around that. We did a ways to engage your children in play-based literacy activities, literacy all around you kinds of things. And we did a couple, I think we did 2 family nights around that topic, but it's definitely the home visits that the teachers do. I didn't mention this, but the teachers do a quarterly home visit. That's they kind of head up the academic piece of that structured piece. The behavior support coordinator does all the behavior management piece. So many of the literacy pieces are delivered by the teachers.
Mm. Okay, great. Now, that's all the questions that I've got up right now, but I might, and please everyone feel free to just post through any last final questions. We do have a couple more minutes. I thought I might just show people a few key resources that they might like to follow up with on the HealthyStart website for those who are wanting more general information. For example, here is one of our practice points, which is about parents who might be involved in child protection hearings. So our practice points are structured so that they talk about the research, what we know, and then they talk about what we can do as practitioners. Let me get back to just actually our main page. So you'll see in our resource section that we have some information around basics. It's a good place to start in terms of what we mean by practical strategies for supporting parents with learning difficulties. Crucial, and I wonder if you agree with this, Renee, is about checking for understanding.
Yes. Absolutely. It's a definite piece of what a lot of our families will say, yes, I get it, and when you know that that's not the case.
Yeah, or you need to check whether that's the case or not.
Right.
Yeah, exactly. So some of the tips and strategies we suggest there is just acknowledging that it's very likely that that someone's going to say yes to something that they don't really understand because they don't want to look silly. And
Yes.
so making sure that you ask a question again in a different way, or ask a parent to actually show you what they mean or give you an example. Ask an open-ended question of what they talk to get an answer of what they're talking about. So here in our practice points section is where we have a number of, I guess, compilations of research that are compiled into what we know, and then some tips and strategies. For example, one of our more recent ones here is father-inclusive practice. So what strategies can be employed by services to make sure that they're engaging fathers. What's the father engagement like at the preschool, Renee?
You know, it's very good. We have a great percentage of two-parent families, and the father engagement right now, especially in our find practices that we're doing with the intervention that we just started, is just absolutely wonderful. For our family night, participation has been very good.
And do you have any data or just some anecdotal evidence about what you think has been good for father engagement?
You know, it's just anecdotal, but I think that our families are well, I'm not sure exactly what's going on there as far as what's causal there, but a lot of our families right now are the strength there in the relationships that between parents is very strong. Mom and dad have a very strong relationship. In years past, we haven't seen that as much. There might be a disconnect there, or maybe a single parent. But this, we have a lot of leaning on each other, and it's very nice to see. It's really beautiful.
All right. Well, the last thing that I wanted to just make sure people were aware of, that our website is more than a website in the sense that it also has what we call our online practice network connected to it. So anyone who joins up and becomes a member of this network is able to post online discussions, connect with people not only just in Australia but in other countries, and I know, Renee, you're on here as well.
I am.
You are. We have a number of our events are advertised here, so it's a good way to stay up to date. And sorry, I'm not signed in right now, but we also then have all our recordings of our webinars stored in here. We can have an opportunity to live chat with other members who might be on the web online at the same time. So it's a really nice way to build up your network and talk with other people who might be working in similar areas as you. Now, Renee, I might end there so that we can make sure that we finish on time, and just finish by thanking you very much once again for your time, and it's just so valuable, I think, with today's technology to be able to hear about services that are speaking to the same needs that we have here over in the States, and hear about how they work for you. Got a lot of people just posting through final questions or in the question window here just saying thank you, and absolutely been great. Thanks to Renee.
Now, you know, my pleasure, and thank you for hosting. This was just, technology is wonderful.
It is, it is. So stay tuned, everyone, for our next webinar. We'll be announcing that in our next e-news. And if you haven't seen the URL for the link to our webinar evaluation survey, it's there in the chat window of your control panel, and will also be sent to you in an email. Sorry, someone did post a question through asking if we'll I'll be putting out the slides for this presentation, which, yes, I'll be happy to. We'll post those out in email, and they'll also be on the Online Practice Network in the videos section. So thank you very much, Renee, and we'll see you online.
Great. Thank you.
Okay. Bye-bye.
Bye-bye.